welcome to Good Afternoon Ghana. I'm Francisca Kakra-Forson. COVID-19 cases, active cases are up. New Delta variant has hit the community. 1% of the population have been so far vaccinated. Today, we are assessing Ghana's COVID-19 response strategy so far. I'll introduce my guests after this break, but don't forget to join us on social media. It's Metro TV Ghana on Twitter, Facebook, and Instagram. We'll be streaming live. You can also send a message to the WhatsApp number that will be displaying on your screen. Please do not call that number, just send the message and use the hashtag Good Afternoon Ghana. Stay with us, we'll be right back.
Bringing you Africa's creme de la creme's classiest hangouts, award shows, end-of-year parties, wedding, graduations, birthdays, fashion or corporate events. Metro Social has got you covered. We present Pizzazz with Je ne sais quoi. Give us a call and we will be there. Whilst at that, join us on Metro Social every Friday at 9:30 p.m. and a repeat on Saturdays and Sundays at 8:30 p.m. on Metro TV.
Now in Ghana on Metro TV. Showing every Sunday evening, prime time 5 to 5:30 p.m. with a catch-up on Wednesdays 4 to 4:30 p.m.
Kids always say what they wanna.
Metro TV, insightful and inspiring moments.
Okay, I want to first introduce my guest for today. That's Dr. Anthony Nsiah-Sarri. He's the Presidential Advisor on Health. Good afternoon to you and thanks for joining us.
Good afternoon.
How are you?
I'm good. And you?
I'm well, thank you. You look very dashing in your outfit.
Thank you very much.
It's good to have you. Just to put the conversation in perspective, what I want us to do is to take some SOT, some clips. I'll start with active cases so far. So just to be up to speed with Ghana's situation of COVID, let's hear Dr. Patrick Kumar-Boaji. He's the Director General for the Ghana Health Service.
The Delta variant has also been identified in the community, which will give further information. As far as vaccination is concerned, about 864,000 plus have had their first doses, while 369 are fully vaccinated. And we must say that currently adherence to the protocols, as outlined earlier, is generally low. Currently, we have recorded about 96,402 cases, recoveries of about 93,987. We've tested about nearly 1.3 million people. Our current active case is 1,619, with an overall positivity, that percent positivity about 7.4%. We have recorded 796 deaths. That means our case fatality rate is about 0.84 compared to the African region of 2.4%. As I mentioned earlier, we've done about total doses given, whether it's one or two. It's about 1,261,677. Of this, we have about 864,900 have had their first dose, and 396 have had two doses. So we have about 560,000 people awaiting their second dose, about 468,000 awaiting their second dose. Now is your
Okay, so on your screen there you can see the active cases. Total cases so far 96,317. That's my count, but what I have is what? Okay, it's been updated. 93,987. Unfortunately, 796 deaths, and I think the active case averagely for the day is 85. So let's come back to the studio. Yes, we also want to look at an interesting or very concerning bit. It's about some cases in the schools. Achimota School, Senior High School alone recorded 135 cases of the new variant, the new Delta variant. Let's hear again from Dr. Patrick Kumar-Boaji.
And the 16th of June 2021, 3 students presented to the Achimota School sick bay with an influenza-like symptom like cough and fever, among others. All 3 were investigated for COVID-19 in line with the laid down protocols. The 3 posted positive, prompting the activation of the Public Health Emergency Response Team of the Greater Accra region, and led by the Okaikwe North Municipality, where the school falls. All 3 students were isolated following the existing protocols. Other symptomatic students, which are contacts, were identified and listed, and also tested for COVID-19. And all the contacts before doing testing was put under mandatory quarantine until the results came. So far, as at the 3rd of July, because of an enhanced approach to trying to contain the situation, we've done about 843 students and staff have been sampled. 348 of them are boarding students, 459 are day students, 36 of them are teaching and non-teaching staff have been tested. We have received results for about 550 samples out of the 843 samples. In fact, yesterday, about 250 samples were taken. And so those are the results we are waiting. I'm sure by the end of the day, the results will be in and be able to come up more clearly. So far, of the 550, 135 tested positive. So we are waiting for the 203 samples, which were collected yesterday from day students. All the 135 cases at the time of diagnosis were either asymptomatic or had very mild to moderate illness. 1 staff was also recorded positive, and about to test, that's about 89 people, students and staff have recovered. I count about 65.5% so far. So the active case, the number who are still carrying the virus, about 46, as I mentioned earlier. These things came about because at the initial assessment by the health sector, we realized that the adherence to the protocol was significantly low, and so a lot had to be done to look at that. So what the measures are ongoing now, for which the Director General of Education will also add, is to the health education on all public requests has been intensified for both day and day students, and then the students and the teachers. We review the cases daily, and discharge of eligible students are being done based on our discharge policy. That's 14 weeks, 14 days.
Since Dr. Abuaji is talking about schools, we'll stay a little longer on our schools. They are of grave concern, and hear from the Director General of the Ghana Education Service, Professor Kwesi Opoku-Amankwah.
Because we have students in school now, what we have agreed on is that for all reports that are done, we put some emphasis on the schools and the COVID situation in the schools. From the figures that we've seen so far from all the schools, and when we talk about the schools, when we talk about the number of people who are in the schools, both students and staff and all others, we are looking at close to about 11 million people in the country who are trapped in the area of education. Since school reopened since January, and from the trend that we've seen so far, it's been encouraging, except that we, as a general norm, all of us seem to have relaxed over the COVID protocols. And as we tend to relax, we see some of these issues going up. So just to reiterate what he said, we all need to encourage ourselves and to ensure that we beef up our attention to the protocols. For us in Ghana Education Service, what we are doing now is to increase the education. We do our continuous education. We have a periodic meetings with our regional directors, and this Tuesday we're going to have that meeting, and we are going to ensure that we're going to give directives to ensure that the schools actually take up the issue of ensuring the adherence to the protocols. From the information that we're getting, as far as classroom situations are concerned, both students and the staff, teachers and the staff, adhere to the protocols when they come to the classroom situation. But the challenge is when they go to the dormitories. And it turned out that for our ladies, they tend to be more, they tend to adhere more to the protocols. For our gentlemen, when they get to the dormitories, it becomes another issue.
That's Professor Opoku-Amankwah, the Director General for the Ghana Education Service. In the studio with me is Dr. Nsia Sare, the Presidential Advisor on Health. Thanks again, and it's good to have you. I'll start off by taking your own assessment. You've been leading this right from 2019, I think, when you were appointed. We've had our ups and downs with fighting COVID. Initially, it was a bit scary. We seem to have found our way around it, and we're going. So far for you, what's your assessment? How has it been?
Yeah, thank you very much, and good afternoon to all of you. COVID is still scary. And the problem that we're having is that people lose their guard and think COVID is gone. So far, I think Ghana is one country which have managed with our scarce resources so far as we can. And if you remember, the first 2 cases came on March 12th. We were then saying, or when we started in January, when it was announced by WHO that there's a new virus and a new and then declared the pandemic on the 11th. I remember the press asking us, why is that we are not getting any case? They said, we are testing. That time we had only 2 sites, at Noguchi and KCCR. Now, as I speak, we had about 43 sites, both private and public. Almost, we have sites in almost all regions. So testing is not a problem. The government has spent so much money in testing and making sure that the kits are available, and luckily the private sector also joining. So on the 12th of March, we had these 2 cases which came from outside the country, and then we started having the cases. Between June and July, we have our first wave, which a lot of people got infected. Luckily, about 80% of the people who got infected were asymptomatic, that they didn't have any signs and symptoms, but there were a few who were hospitalized. We managed it. That's where we introduced, if you remember, beginning we introduced a limited restriction or lockdown in Greater Accra and Greater Kumasi metropolis and its surrounding contiguous districts and municipalities. We did it for 2 weeks, and then we advised His Excellency the President, and he added another 1 week. Locking down a community or locking down a state is a very difficult thing, because in this part of our world, people are used to going for daily things, like in the market, to go and sell things and then buy things that they will use for the day. People don't keep food. So when we were locking down, we look at all these things and didn't lock down the markets. And we didn't also completely stop the transportation of people, but we restricted the number of people in transport. Once you start doing all these things, some people's livelihood will be affected. Socioeconomic life was also compromised. So as the President has always been saying, that we want to go back to our normal socioeconomic life as much as possible. But we have not been in normal times. So when we had the first spike in June, July, then luckily we put in restrictions. We did about 6 different key things that we did. First, we were using the data, and that's where we got the data from. When we locked down, we were doing the enhanced contact tracing. We go to a perimeter within 1 kilometer. Anybody there who is positive, we test everybody around the place. And then we were using science. We were looking at what is happening in other parts of the world, and then learning lessons from there. That time, everybody was locking down the states. Sometimes, some people, even up to today, they've locked down, or they locked down and opened. Ghana, luckily, we've locked down only once, even only very small part of where we had a hotspot. Then we have to then look at where there's potential spreaders. We call it super spreaders. These are areas where we have more than 10, 20, 30 people meeting. Churches, schools. For the first time, there was no Easter celebration in 2020. For the first time, mosques were all locked. Ramadan was done quietly in-house. So we locked down schools, we locked down everything, and then after June, we started opening schools for the students in the final year to go and write exams. They went successfully. Government spent a lot of money providing all the logistics. At the same time, we were thinking about the people who bear the brunt of all this pandemic. That's the healthcare workers. So we have to provide them with PPEs. We have to make sure that we have the logistics in our scarce resources to be able to contain this disease. And then we continue testing, contact tracing and testing. So we are using what we call the 3 T's. You trace, you test, you isolate those who are positive, and then treat them. So we have to now start getting places where we can put the positive cases who need care. The patients come in different ways. As I said, most of the patients during the first wave were all asymptomatic. So they need to be cared for at home. Somebody has to follow them. There's another group of patients who have maybe mild diseases. There are some of them who have comorbidities, that is hypertension, diabetes, and these are the diseases which somebody get COVID, then they die quickly. So we have to take care of them. At the same time, we have people who have got what we call the severe, moderate cases, then severe and critical cases. The critical cases need to be well isolated and managed at critical care units, which we have very few. I think Ghana, we don't have more than 200 critical care beds where you can put somebody on ventilator, oxygen, and the rest. And if you realize recently, when India, of all places, had a problem, they even came to Ghana asking for if we can give them oxygens. And Ghana donated some oxygens. The Indians here bought some oxygen ventilators, oxygen concentrators, and sent to them. That is how this disease is. That's why sometimes we say that people should not lose their guard. Because the disease is real. It kills. It can make you go and then lie in the intensive care for a long time. And you can infect people easily. So the most important thing is you have to protect yourself, protect your family, and protect the society. So in July, when we had these problems, and then we started opening the schools, and then we realized that when the students went to write the exams, we didn't see much problem. Both the SHS, JHS, and also the final year university graduates. And then we went ahead and said that we cannot, the borders were closed, by the way. But I said that we cannot continuously be locking ourselves within our four corners. So people were coming in. But when they come in, government took it upon themselves to also isolate everybody who came in. You remember the first 1,065 who came into the country, we isolated all of them on the cost of government, tested them, some were positive, about 10% of them became positive. So it was even teaching us how the dynamics of the whole disease is. And then we then decided that we would try and open the airport. So what do you do when you want to open the airport? We know the disease was imported into the country. So if you want to open the airport, you have to make sure that you don't import more disease into the country. So we then said that we should get a testing regime, which other countries, when you go, you have to go for isolation. 3rd day you do a test, 5th day you do a test, 8th day you do a test at your own cost. So you say, why don't you do a test at the airport? Isolate all those who are positive, like we're doing for the contact tracing and isolation and treating. They manage those who are positive, and then let those who are negative be you counsel them, let them go home, and if they have any signs and symptoms, we follow them up. That's exactly what we did at the airport. And so far as some of us are concerned, it has limited the number of different strains which are coming into the country. So it was one thing that Ghana uniquely did, which most countries have not done. And
how do we know that?
Because most countries don't test at the airport instantly. They will let you go home or go to a hotel and then go at your own well, or you go to a place where you book to go and test. But Ghana is testing at the airport instantly. Okay. And that's the most important thing about what we are doing at the airport.
Okay. I want you to just draw closer to your conclusion so that I can...
So what I would say is that so far so good, but we are not out of the woods yet. We've managed. And then we lose guard a bit during the Christmas festivities. You know, we have a lot of people in the diaspora who came for holidays, and they all came home. And you saw what happened, because people, when the disease goes down, when the number of cases go down, people think that now they are free to do whatever they want to do, as it's happening now. So in January, we saw what happened in December after the elections, the whole hullabaloo about the elections, and then the euphoria about the elections. Then we have the second wave in January, this year, February, and March, especially in February. We had a lot of cases, and they came in with different strain. That's why we have the what we call the Alpha strain, or the British or the UK strain. So you see, this pandemic, a virus is like a chameleon. They change the ways that they come. When they come in stronger. So we have what you call variants of importance and variants of concern. So there are variants of concern which WHO have named it of Greek alphabets, alpha, beta, delta, epsilon, and the rest. So these are the new variants which are coming in, which we in this country are trying to make sure as much as possible to limit it at the airport.
We'll get to the conversation about the variants. Right now, I want to ask you: is it safe to say, or is it fact to say, that we are in a third wave? We've heard from some scientists say that we're already in a third wave.
When there are waves within our sub-region, within the world, you see, we have the world is a global village. So once any country has a wave, there's a potential wave coming towards you. So what is happening now? We started seeing surges. Where wave is that continuously there will be a very rapid increase in the number of cases. We are seeing increase in number of cases, but it's not as rapid as we see when the wave is coming. So I will call it surges. But we are mindful that if you are not very careful, what happened in June, July, and what happened in January, February, March can happen. It started like that. So we are very, very mindful that I will not say we are in a third wave. I will say that we're having surges, and if we are not very careful, and we don't go strictly by the protocols, we will go into a third wave.
It's
which will not
important.
be very good for
it's
us.
important that you make that point, which the Director General of the Ghana Health Service also said in their statement. They talked about low adherence generally to the COVID protocols. It also brings to the question about the EI 395 of the Imposition of Restrictions Act. And this emerged during the banter between the police and the NDC about a protest, that the act has expired. So the question then will be that not the EI has expired, not the act. The question will be then, under what are we operating then?
I don't think the act, His Excellency the President has renewed it for another, I think, 4 weeks. You know, it goes to Parliament, they give a period. So after it expires, if you want to renew it or do another act, the President has to go back to Parliament. But the President has the opportunity to renew the act periodically. I know it has been renewed. So it's not true that we are not working on that any year.
So it's been renewed.
It's
so
been
it's
renewed
not
for
expired.
another 4 weeks, what I saw. So it hasn't expired yet.
So are we, at what point in the 4 weeks are we then?
I think it was renewed at the end of June or so.
Okay.
So we are within the normal 4 weeks that we have. It has not expired. So there's an act. Yeah. So if the police is saying that there's an act, restriction act, it is there. It has been renewed. It's completely expired.
Okay. And question I would want to follow that up with is how are we then going to get people to adhere strictly? Because as you said, once cases drop, everybody begins to feel comfortable. We are not, obeying the protocols. We're not wearing the nose mask. When we enter buildings, we're not washing our hands. We're not doing what we have to.
That's why you and I are doing now. What you are doing now is educating people. I believe more in education than just arresting people. If you want to arrest people, I'm sure this room we shall arrest almost everybody except me. Because people are here who are not wearing masks. That's how it is. So
thank you for that, and I'll entreat everybody in the studio to wear their masks. Yes, we need to make
including
the guests
yourself
as well. Okay.
So if you do that, if you want to arrest people, the prisons will be full and there will be no social distancing in the prisons. So the most important thing, so far as I'm concerned, is education. You should continue the risk communication. You should continue educating people. The mask wearing is very, very important. If you wear your mask, I wear my mask, I cannot give you beta or alpha or delta strain.
Okay.
If everybody washes the hand, if the hand washing, so far as I'm concerned, again, hand washing is a good thing which has come out of this COVID.
Okay.
It prevents a lot of things. It prevents, for example, cholera. From you getting cholera, you wash your hands very well, you cook your food very well. It prevents also diarrhea disease also will go down.
Okay.
Typhoid and the rest.
So
it is important.
At the barest
and the
minimum,
use of sanitizers. I believe that if we haven't learned anything at all, or we haven't had anything from this COVID, is the hand washing, which we should inculcate into the people, especially from kindergarten, nursery, right down to the highest level.
Doc, is it correct to say 1 million people or 1 million of the population of Ghana has been vaccinated?
Yes, I'll give you the real figure. I think that the Director General said it. As at 5th of July, the figures I have here is we have given at least one dose to 1,265,306.
Okay.
1,265,306. And at least 864,964 have received their first dose.
Okay.
And then out of this, 400,342 have received their second dose. So we are waiting to vaccinate or give the second dose to another 464,622 people.
Do you have that dose?
We are always preparing to get vaccine, and we are trying to get the AstraZeneca vaccine especially for these people. But very soon, in the next few weeks, another batch of vaccines are coming in, which we will use to roll out the second phase. How
many, and when specifically?
I cannot tell you the time. It was only yesterday that you received communication that another batch of vaccines are coming, which is very, it's about over 1 million, which will start the second phase of our vaccination program. You know that His Excellency the President's vision is to get about 20 million people vaccinated by 2020. 2021 December.
By
We still
acquiring
stand by it.
17.6 million vaccines.
Yeah, we still stand by
doses.
it. We believe that in the third, fourth quarter, we will get a lot of vaccines coming into the system, which you can use to achieve whatever you want to achieve. If you don't achieve it, we may go into the next quarter of the year and then finish
Of
up.
the following year?
Yes, because you see, the best thing to do in this pandemic is to vaccinate people as quickly as possible to achieve herd immunity, so that all the strains which are coming, everybody will be vaccinated,
So-
and then we can then go back to somehow normal life that everybody
So
wants to live.
it appears we may not be on track then.
I'm still optimistic,
Okay.
because I know that this third quarter and then the fourth quarter, there were a lot of countries who are the manufacturers of the vaccine, especially UK and then US, would have vaccinated a lot of their people. So what we are getting now is what His Excellency Joe Biden announced, that he's going to give about 80 million vaccines, doses of vaccines to the developing or the third world
This is through the
countries.
COVAX?
Through everything which is coming will come through the COVAX. But African Union is getting a share. Ghana will be getting another share as a priority country, the 13 priority countries that the US government said they will give.
Okay.
Ghana is one of the, I think, 5 countries from Africa. And we are going to get a share from it. We'll get a share from the African Union, and we'll get our share also from the COVAX. So we are going to get about 3 different shares. African Vaccine Alliance Trust is also, AVAT, is also trying to mobilize vaccines, which we can also go to the African Vaccine Alliance Trust to buy. And then also COVAX is also trying to mop up vaccines also from the European Union. And that's what I am very much optimistic that by the end of the year, or the second, the third and the fourth quarter of the year, we'll get quite a number of vaccines into the country. And we're also looking around as a country on bilateral basis, and even of individuals, to see if you can get vaccines into the country. So we are doing everything possible to bring in all vaccines.
What will be the challenge in acquiring or in obtaining the vaccines? I was reading a comment from the World Bank country director was alluding to certain difficulties in obtaining the vaccines. World Bank loan recently approved by Parliament, 137 million of that's expected to acquire vaccines. So the money appears to be available to some extent.
Yes.
What would the other difficulty be then?
The other difficulty is vaccine nationalism and the politics in vaccine.
Vaccine nationalism.
Yes. Everybody who is producing vaccine, the vaccine producing countries, want to finish vaccinating their people. For example, we got the first doses of AstraZeneca from Serum Institute of India. India then went into a problem. So they have put a ban on export of vaccines. Until the time that they vaccinate a lot of their people, it's very difficult to get any AstraZeneca from India. If you go to UK, they are also keeping a lot of vaccines to vaccinate their people. And that's why I said that UK has vaccinated, I think, first dose about over 70%, second dose, they are getting to about 50-something%. So very soon, there will not be anybody to vaccinate again. And I'm sure and then at the last EU meeting where our president went to, the African leaders who were there also mentioned that African Union leaders have also been complaining.
Okay.
The WHO has been complaining. World Bank has also been complaining that they should release vaccines that they cannot use. Because if you see the vaccines that countries have, the vaccines are not made and put on the shelf. The vaccines are made for people who have put in money. All the manufacturers who are making vaccine were sponsored by countries. That's the reason why African Union has said that we want to start also developing and manufacturing our own
I was
vaccines.
just about to ask that.
So if you do that, they will have vaccine security and so become sustainable in giving vaccines, not only COVID vaccines, but also for the EPI, Expanded Program on Immunization Vaccines.
Okay. Where are we with that conversation or with that step? I think I've heard the president even talk about that as a possibility, locally manufacturing vaccines, perhaps as a solution to this vaccine nationalism going on.
Yeah, that's the solution to it. Because Africa, about 99% of vaccines, especially childhood vaccines that we give to children, are imported. Only 1% is either fill and finish
So what's it going to take then?
So what African Union has pledged is that by 2040, it should be 40-60%, not 1%, 99%. And that is what the economic blocks in Africa, everybody is trying to do. And Ghana, we want to be a vaccine development and manufacturing hub, if for nothing at all, for ourselves and for the sub-region. So His Excellency the President, you remember, I think in February, set up a committee, which is headed by Professor Frimpong Boateng. The committee is working around the clock, and the committee has done a lot of preparatory things. We have met a lot of manufacturing companies. Some of them have formed consortium. There are other developed countries who are vaccine producers who are also trying to help Ghana to bring the technology transfer, and also even funding, because vaccine production also comes with you have to do a lot of research and development. Luckily, we have research institutes, we have universities who are prepared and doing research and development, even in clinical trials and the rest. So we have some advantage there. And then we have also very good pharmaceutical companies in country who want to join together to help this government's vision. So we are working closely together. And
when do we hit the ground running?
We will hit the ground running very soon. Very soon, the president himself will come out after we have finished the work of the committee, has finished its work, present to the president, and then he'll come out and tell us.
Sometime this year?
Very soon. I'll say very soon, because the president himself is very key. He's following it on a daily basis. And this is where we want to get to as quickly as possible. Okay. Not only for COVID vaccine alone, but for EPI or childhood preventable vaccine that we are buying and giving to our children in this country.
Doc, what about the bargaining power of African countries, a lot of which will be categorized as poor countries? How has that impacted on the acquisition of these vaccines, aside the politics going on?
You see, our bargaining power is that we have Africa, for example, have a population of, I think, about 1.5 billion people. It's a relatively young population. All these vaccines we are talking about, most of the vaccines come to Africa. Because Ghana, we are very good in our expanded program of immunization. We are immunizing children to about 96%, 95% of the children are vaccinated. So we are very good in that. So we procure a lot of vaccines from these developed countries. That is one. The second point is that we are a continent where we normally we exploit our raw materials and then we send to these countries. So these are all our bargaining power. We have the market. Not that we don't have the market. Africa has a market. If you all decide that maybe Ghana is producing COVID-19 vaccines, measles vaccines, Penta-5 vaccines, all the other vaccines, and all of us decide that irrespective of whatever cost it is, we will buy from Ghana. Okay. We will get the market. So that is what Africans have put together, and I'm very happy that African Union, African CDC is very serious about this. They have now formed a committee which is working seriously, and every week or every 2 weeks we are discussing and we want to move forward. We have a roadmap, and we want a lot of countries who are prepared to go into vaccine production, and for that matter, pharmaceutical production. Okay. We should be buying from our own. We should be producing and consuming as a continent. And once we do that, the developed countries will see that we have the power. Because we have everything. The only thing we don't have is the money. But you can create this wealth through this type of not only raw materials going out, but manufacturing as well. And that's exactly that we have learned in this pandemic, and all the African heads of states and African Union, for that matter, African CDC, have come together to make this thing happen.
Okay. At this point, I would want us to take a break here on Good Afternoon Ghana. When we return, we'll extend the conversation a bit. I'm happy that you talk about wealth creation. I would like us to go into the airport restrictions there and the tests, and even the finance of it, any opportunities for local partnerships. It will be interesting to know. But my guest in the studio is Dr. Nsia Sari, Presidential Advisor on Health. We've been talking, we've been assessing the response strategy to COVID-19. Stay with us. Let your messages come.
Are you tired as a consumer in Ghana when it comes to issues that confront you as a consumer? Worry no more. Kofi Capital, I'm here to give you the information, all that you need to make sure that your right is protected as a consumer. We have too many laws and agencies that should protect the rights of the consumer. I'm here to give you the information that will help and assist you to get goods and services delivered to you without any worries. Watch the Capital Show on Metro TV.
Welcome back to Good Afternoon, Ghana. Dr. Nsia Sarah is still with us in the studio. Doc, just before we move to the conversation on what's happening in the airport, I just wanted to touch on two things that would have come up. The expiration of some vaccines and also the costs, or what was tagged as expensive vaccines. So that what went wrong in the decision making where some vaccines were said to have expired?
I'm not aware of vaccines getting expired. I remember very well that when we had doing the second dose, or is it the first, there were, I think, Northern region had about a few ampoules, which is 10 vials, 10 doses, which you couldn't give before the end of the expiry date. And also, I think, OT. So in all, I think the only vaccines which we couldn't use was less than 500 doses. That's what I remember.
Okay.
Because Ghana, as I said, we have a very good, robust, decentralized system that we use for vaccination. We've been using it for years. We can vaccinate, even during, in 2020, at the September, October, we did vaccination of about 5 million children for yellow fever within a matter of a week. So we are used to it. We use our community health nurses and our vaccinators at the community level.
Okay.
So there's no problem of expiration of any vaccine here in this country.
Okay.
Because when the vaccines come, you remember that when vaccines come to the airport, FDA, which is a very well-renowned regulatory authority, goes there to check the manufacturer, the batch number, where it's coming from, the cold chain system, the expiry date, the manufacturer date, before they allow it to go into the EPR cold room. When the papers were not even ready, the ones that we got from DR Congo, they quarantine it. Okay. I'm sure you haven't heard quarantine vaccines before. They will quarantine it and will not allow you to use it until the following day we had the papers, and then they went through the papers and allow it. So they are very strict about this.
So in this case, I'm just trying to understand what you're saying. In this case, they didn't expire, but what, they were left? No,
as I said, it's about, is it 40 vials, which is about 400 to 500 doses, which got, they couldn't use, not that they expired. They couldn't use, and they didn't bring it early enough for other regions to use. If they would have brought it, that, we cannot get the people to use it for, so other regions you use it. Okay. It would have been done. But we don't allow vaccines to expire in this country.
Okay. Let's talk about the costs then, because there had been some criticism about the $19 per dose, now at $10. What's the deciding factor? What's going into whether we're doing, is it AstraZeneca or Sputnik, which is said to be costly, a bit more costly?
Yeah, Ghana has registered a lot of vaccines. We're giving what you call emergency use authorization. Ghana has registered AstraZeneca, giving AstraZeneca emergency use authorization, Sputnik V. There are two types of Sputnik. Sputnik V, which is 2 doses, emergency use authorization, Johnson & Johnson emergency use authorization, and about 2 weeks ago, we've also given it to Pfizer and Moderna. So any vaccine which Ghana, somebody, or you would bring it to the Food and Drugs Authority, they will go to the dossier and then give its emergency use authorization. And Ghana, the policy is that we've made up our mind that we shall use any vaccine which have emergency use authorization by our Food and Drugs Authority, in addition to whatever WHO has also done. Because our Food and Drugs Authority is a very well-renowned Food and Drugs Authority. And so anywhere, when you get any of these vaccines, we shall deploy it. That's what we are doing. That's the principle. So we had some Sputnik. Yes, Sputnik, I know from the ex-factory price is $10. In fact, actually it's $9.95. But when somebody gets it and you're bringing it here, there are two things. There's an ex-factory price, FOB, and there's also CIF. CIF that somebody will put it on the plane and bring it to this country, and then it's deployed. Sputnik has a lot of accredited distributors, because there are people who put in their money and they are using it in terms of getting doses to sell to the country. So they will come, and when they come and they want to sell it, it's supply and demand issue. I didn't do economics, but I know that when the demand is very high and the supply is low, prices go up. So it's ability to negotiate and then get it at the right prices, and then you can then buy it at a price. So if somebody gets it from $10 at the X factory, it doesn't mean that when somebody is bringing it to you, taking by freight and then cold chain will give it to you maybe at $10. It's like going to buy wholesale and then retailing. That's how it is. Ghana is using all multiple sources of procurement of these vaccines. One source is from the COVAX, which is supplying 92 AMC countries, which Ghana is one of them. And two, we can get it also from the African Medicine Supply Platform. That is where we got some from when we had some MTN procure some for some countries. We also have other bilateral, that's government to government. Government talks to another government to see if they can get us some vaccines. And then you can get some individuals who are accredited distributors of the vaccine can also come to you that you have this vaccine, you talk to them, you negotiate with them and get the price. So the $19, if you remember, people were saying that, oh, there was even $26. But later on, there was $19. Later on, even somebody came $18.5. It depends upon when you have to get it. And even later on, there was also negotiation going on government to government, which will be about $13. I'll tell you a story. For example, Israel, when they wanted to do their vaccinations as quickly as possible, were buying Pfizer, which if you go on net, Pfizer, the S-factory price, I think is $19.50 for a dose. But at a stage, some of them were buying for $30, $35. It's the most expensive. But I remember their prime minister said that he wants to achieve herd immunity as quickly as possible so that the country can go back and start its normal socio-economic life. Because whatever money that they put in, they will get it from people working and getting taxes. So that is how it is. A supply and demand issue. So far as I'm concerned.
We'll leave it to the markets then. I want us to, as we draw the curtains, I have about 5 minutes, but I want us to talk about the COVID-19 National Trust Fund levy and how much that has been able to pull from donations, etc. Also, the 1% COVID-19 health recovery levy. How are all these streams or sources, supporting in the work as well?
I'll talk first about COVID-19 Trust Fund. They've done excellent work under their board of chairmanship of a leadership, former Chief Justice. They've done very well.
How much do they have in their
account? I cannot tell offhand, but I know that they have some few millions of cedis, dollars.
The last check as at June 2020 was a mobilization of 53 million cedis.
And I'm with them in the same block, and I know the sort of work that they are doing, the sort of commodities that they've given to hospitals, to communities, to even for risk communication and everything. So they are doing all sorts of things. They are supplementing whatever government is doing. That's exactly what the trust fund was established for, and they are doing wonderful work. As I know, I saw also, I think, whatever money they have, how they use it, auditors, Ghana Audit Service will by all means be auditing them. I'm not a member of the trust fund board, so I cannot tell in details what is happening. But what I will say is that they've done wonderful work and they continue to do wonderful work.
Okay.
Anybody listening to me, if you have anything to give to the trust fund, please give it to them. They are doing a good job. Two,
very well.
The levy. Yes, it was passed, I think, the last budget, that the COVID-19 levy.
Yes.
There's also a program for it, which I'm sure will pass through Parliament and everything. And then when the levy starts...
It's already taking effect.
Yes, taking effect.
Yes.
So it will also be used to supplement and make sure that some activities which, because of COVID, we want to have also can happen. So it's something which is also very good that if you get the 1% levy...
But it appears to be, I mean, if we have a trust fund where there are donations, this 1% would be a
trust fund is if people using their own initiative to go and pay. Levy is like VAT. When you put a levy, a tax, and it's very difficult. I mean, paying tax is like removing a small hair from your nose. It's difficult, but if you do it, it's very good for the nation.
Okay.
All nations survive on tax. So that's what I know the levy is for.
Very well.
And it's going to help us to achieve whatever activities we want to do post-COVID.
Okay.
Because going forward, we have to make sure that
are we going to see that tax removed once there's no COVID?
I'm not too sure. I think, yes, if there's no COVID,
okay,
they can call it COVID-19 levy.
Okay. I want to, in conclusion, I want to wrap up with the conversation, a quick conversation on the Delta variant. We know that, for instance, Achimota School has got, 135 cases. We earlier were told that it had been imported through the airport and subsequently it had made its way into the community. What's government going to do about this particular variant, especially because of how it is hitting the schools?
Really quickly, what I'll tell you is that what we are doing in this country is that any positive cases, we're doing what you call genomic sequencing, which is done by WASIP in Legon, University of Ghana, Noguchi, University of Ghana, and University of Health and Allied Sciences in Ho. So far, they've done for about 1,708 patients or people who are positive. 1,262 are from local population, those who have not traveled, and then from the travelers, 446. So they are looking for different variants of as I said, the virus mutates. So we have the Alpha, which is the UK variant, we have the Beta, which is South Africa variant, we have the Gamma, which is Brazil variant. So they've named it the Greek alphabets. And then we have the Delta, which is the Indian variant, and they have what we call variants of importance. So these are the variants of concern. Do
we have all of these in Ghana?
Yes.
Okay.
We have all of these in Ghana.
Including
in fact,
the Brazilian.
If you look at the highest one, if the of concern is the Alpha or UK variant. The Indian variant, which is the Delta variant, we also have it in this in the community. It's about 40 of them. In fact, 34 of them have local population, not only in Achimota alone. Achimota and some other about 7 locations.
Okay.
What it means is that once you have in the local population, it means that such a variant has gone, it has local penetration, so it's distributed locally. That's the reason. The whole thing about all these variants is that go strictly by the protocols. Wear your masks, wash your hands, use sanitizers. Don't go to crowds where you are not supposed to go to. Avoid any super spreader. Anywhere that there's crowd and you feel that if you don't go, there will be nothing. Don't go. If you go there, be in your mask.
Okay, and
if the two of us are in our mask, if you have Delta variant, I have Alpha variant, I cannot give it to you. It's not easy to give it to you. And you ask a question, which I have to answer quickly. I told you that the test at the airport is to limit importation.
Okay.
It doesn't eliminate. So we have two areas where we limit the importation. One is 72-hour PCR test, so we sieve it there. And those who are negative who come into the country at the airport, because 72 hours, so within 24, 48 hours, the person can be reinfected. So when he comes to the airport and he's positive, we do this immunofluorescent antigen test, which is instant and it gives you a result in 30 minutes.
And it's only to limit.
limit, not to eliminate
okay.
completely.
I'm afraid we'll have to.
Understand.
I'm afraid we'll have to leave it here. But what you said that I will leave the audience with is go strictly by the COVID-19 protocols. My guest has been Dr. Anthony Nsiah-Sarri, Presidential Advisor on Health here on Good Afternoon Ghana. I'm grateful to you as well for joining us. I'm Francisca Kakra-Forson. Thanks for watching. We'll be back again on Friday.
Metro TV, insightful and inspiring moments.
It's News Night here on Metro TV and also on DSTV channel 277. In current affairs, we have the latest political and social news. The Business Bit brings you up to speed with the happening